Okay, so again, if you have any questions, please just kind of give me a shout out in the text box. Please say something. I don't want to really hate like talking for 4 hours. I want it to be very interactive. Ask me lots of questions. Okay, and if everybody could please mute their backgrounds. Just hit a mute. If you see on your screen, there's a little microphone beside you. Just mute it. If you want to talk, unmute yourself and then talk, but just mute yourself, please. Just makes it easier for everyone else to hear. Not about you, but in my house, I have lots of dogs and cats and good stuff. So I'm using this book to start off with today. This one is the questions for the NCE counselor exam. I like this book a lot just because it divides it up into categories. I think when you study, you really should study in categories. There's lots of names, lots of people, and it's a lot harder if you're not studying it in categories. Okay, so we're going to do assessment, testing, and research, and then I'm going to use another book that just has lots of questions. Okay, so again, if you want this book, I'll send you the Google link, and you're more than welcome to have the book. Any material I use in the session, you're more than welcome to have it. Okay. So I've probably talked to you a lot about, or if you've seen me on Facebook, about the importance of using kind of the bell curve. Okay. And there is one in the green book. If you know what I'm talking about, the green book, there's a really good one in there. But you really need to memorize this and just really know what it looks like for this test. Open my drive, and I'm going to show you. It's just normal distribution. Okay. Share. I'm going to copy that link. I'm going to put it in the chat box, so it's yours. You can just go and share. You can use that. So this is going to answer a lot of those questions when it comes to really figuring out like what the answer is. So if we could just kind of take a look at this is a normal bell curve, a normal distribution on a bell curve. So on a normal bell curve, a standard bell curve, we know that the mean, median, and mode are all lined up in the middle. Okay, so if they're not lined up in the middle, then we've got kurtosis or the plecosis, the other one, PLY, and we can talk about those. But what we're looking for is the normal one, where everything is lined up, mean, median, and mode. If you don't remember, the mean is the exact middle, where you take those numbers up, you kind of add them together, divide them by the number that you've used, and you get your average. The mode is the number that appears the most often, and the mean, median, and mode. The median is the one in the exact middle. Always remember that when you're driving down the road, there's a median strip, and that's one in the exact middle that divides it. What we know is on a bell curve that if there are 100% of the people in the world, whatever you're measuring, if there are 100 people in the world, that 68% would fall within the norm, the first standard deviation. Okay, so that is, again, if you're looking at a normal bell curve. So we know that there's 100 people in the world, and we're looking at the average, the mean, that's where they go. The first one is 68%, the second standard deviation is 95%, and the last one is 99.7. So what we know is all the people in the world lie within these if you're taking a survey or using something that looked at a normal bell curve, they would all be right there. Outliers, of course, are on either side. Those are very small on the either side of that. So the important part, though, is looking at these things, your standard deviation, percentiles, z-scores, t-scores, as well as your stanine. So your stanine is divided into 9, and what you do, you know that 20% of that is at the mean, median, and mode, the middle, okay? And then you're going to go down 3%. That's 20, 17, 12, 7. And I would just ask you just memorize those. So it's 20 in the middle, and then down each side, okay? So then your exact stanine is divided into 9s. Again, so start in the middle. So I've got is, my little 4.5, 5 right in the middle. And then these are my stanines. So if someone is a 9th stanine, that is what that means. This is where they would land on a normal bell curve. Your t-scores, okay, so if you're doing a t-test, your t-scores, we start the mean, median, mode at 50. And then we go down 40, 30, 20, up 60, 80, 90. Again, just memorize those. You don't have to understand why they work if you don't know a t-score. A t-score is what we use when we're comparing two groups or two different variables. That's when I use a t-score. Okay, my z-score, of course, that the mean, median, and mode are all in the middle. So I'm going to go down, 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 move on, down, and up. I do know, again, this is just factual information, that a standard deviation of my z-score is -3 or +3. Standard deviation of my z-score. Okay? And then my percentiles, again, at 50, then go up and go down. Okay, so that's going to help you a whole lot when it comes to just really understanding how these things work. Okay, so then let's go back and look at some questions. Okay, going to go over some terms with you, just when it comes to assessment and testing. Test or retest reliability, all that means I took the test one time. If I take it again, I should get around the same ballpark. If you took the NCE, you take it one time and you don't do anything different, then your score should be the same ballpark the next time. That's just the way that it works. Test, retest. That means my test is valid and reliable. Okay? So then my parallel forms reliability. That just means two forms. The NCE has a couple of different forms, so all that means is those are very reliable. They work together. Inter-rater, that reminds me of the talk shows, the people who on the game shows, The Voice, things like that. What you're hoping is that all of those raters give them a kind of the scores in the same place. That's inter-rater reliability. Two raters, and they should be reliable. Okay. So internal consistency, you're looking at the inside of the test. We're talking about internal, it's always the inside. Split half, all that means is that if I am going to take a test to see it and then check for reliability, the odds or the even should be the same. If I have 50 questions, so if I said the first 25 and you do the second 25, you should get around the same score. If I said do 1 through 50, but only do the evens, and the other person does 1 through 50 and only does the odds, you should get the same score. That just means if I take that test, split it in half, I'm going to get the exact same information. Of course, we know that in order for it to be valid, in order for it to be reliable, it has to be valid first. Okay? And there are a couple things about that. Content validity is does it measure what it's supposed to measure? On the inside of the test, does it measure the content? On the NCE, every one of those questions is related to something. It's related to ethics. It's related to assessments. It's related to some of the content area, the domain areas. So in order for it to be valid, it really must be the content has to measure what it's supposed to measure. Okay, that's validity. Face validity is just by looking at it. If some person off the street who know nothing about this test, if they looked at it, would they know that it was valid just by checking it? Criterion, of course, is does it match what it's supposed to measure? Construct looks about how it's made. When it's constructed, did it do what it was supposed to do? Okay. And then we'll talk about some of those famous people, of course. Sir Francis Galton, he was actually a cousin of Charles Darwin, and he is one of the people that really suggested that there was a genetic piece to IQ. And if you always remember Sir Francis, he really kind of was the aristocrat, the aristocracy at the time, the upper middle class people with lots of money, the wealthy people, and they were really making sure that their bloodline was what they believed is that was their bloodline. So if we continued to pass on this genetic bloodline, then it would make these very smart people. So that was Sir Francis. Of course, Gulford, J.P. Gulford, what he did is he was one of the first people that looked at divergent thinking. He looked at whether or not the testing, we could measure other areas, because we were so used to just measuring IQ testing, and he suggests that we look at maybe art or some other issues that could be tested. Okay. Spearman, of course, he's famous for the G factor. We'll talk about him a little bit when we talk more about in our research area. But he's Charles Spearman, and sometimes we'll see the Spearman G. Okay. Alfred Binet, he and Theodore Simon, they came up with the first IQ test. You guys know that standard IQ is 100, whether it's on the Wechsler or on the Stanford Binet, it's still on the 100. And what we know then is that standard deviation on IQ is from 91 to 109. That's a normal standard deviation when it comes to my IQ. Okay. Let's see, Cottrell. He is famous for his theories on fluid and crystal intelligence. So fluid intelligence is intelligence that kind of changes with us. Our crystallized intelligence does not. I like images, so if you'll see. So my fluid intelligence really has to do with what I learn over time. Okay, so crystallized are things that I know. I always say hardened. They're hardened. They're past learning, past experience, based on facts, increases with age. So that is my crystallized intelligence. The older I get, the more I know. Again, fluid intelligence, however, it helps us grow. It helps us learn new things. And what we know is as we get older, our fluid intelligence kind of levels off. So our crystallized intelligence does not. That's the hard stuff, the things that we know. I always touch my desk because it's so firm. However, see my fluid intelligence, that's my ability to learn. I got the newest iPhone. Can I figure that out? I've gotten the newest garage door opener. This weekend I was trying to set up Alexa to start my car. And yes, I did. I was so proud of myself. But that's fluid intelligence. That's the ability to take the latest technology, the newest things, and get it together. Okay, so crystallized intelligence goes up, fluid intelligence does not. Okay, let me get rid of that one. Okay, and that is based on the work of Raymond Cottrell. Wechsler, you guys know. Wechsler's the one, the IQ test we use most often now. And the way to remember which one he does is the WAIS, W-A-I-S. That one is for my adults, AIS. And then my children, SC, children, the Wechsler scale, the Wechsler intelligence scale for children, and the Wechsler preschool. That's the WIPSI. So the PP is for my preschoolers, or if you remember that they still kind of PP, those are kids that are usually 3 to 5. You get a lot of families who want to get their kid into school early, so they would use the WIPSI to look at the child's IQ. Okay, so then we look at the intelligence scale for kids. That's my WISC again, that's for children. And that is up until the age of 16. At 16, many times you can use the adult scale as well. But the WAIS is the adult scale totally, W-A-I-S, the WAIS. Okay. Ertl, he did my EEG. Okay. Some important terms also, the appraisal. The appraisal is just anything that we use to observe, or sorry, anything but observation, anything we use to get a measurement of how we're looking at an object, looking at variables, how we measure it. Of course, classroom communication, you know what that is. We talked about my bell curve. That's my normal standard deviation. My correlation coefficient, that needs to be between -1 and 1. 0 is a perfect correlation. Okay, so what I'm looking for is the correlation between coefficient correlation. I don't want that one. What I know is that 0.70 is acceptable. Let's see here. What I know is when I'm looking at it, what I want is to be between -1 or 1 or -1. 0 is a perfect correlation. So I cannot accept anything below 0.70. So the test asks me 0.50. What would that be? That would not be, I could not use that assessment because it doesn't give me enough correlation between the two assessments, between the two variables. Okay. External validity, that really looks at if I take this test and give it to other people, how well will it get the same answer? So if I'm looking at, children that are in, 5th and 6th grade in Tennessee, and I give that same test to kids in 5th and 6th grade in Alabama, will they get around the same thing? That means that test is valid. Forced choice, those are the ones that you have to answer. So it's usually 1 or 2 specifics. You have to say yes or no. You have to pick an answer. Those are forced choice items. The halo effect, that is a term that is used for people who we think are amazing. It's the halo on their head. It doesn't always have to be people, though. I've seen it used in other sentences, like when you see something you just think is amazing, that's your halo effect. I'll give you an example on that one. My father died of cancer about 2 years ago, but his doctor had the babyest blue eyes, and I couldn't wait to go see him. And of course, the halo effect says I'm more likely to listen to what he says. I'm going to do anything because of his looks. So that is the halo effect. Okay. Yes, he was. He was just the baby blue eyes. Ipsative, I've heard this a couple of times. Ipsative means that you're comparing your test to your own test, not to someone else. Okay, so if you're looking at your NCE score and you're comparing it to your NCE score last time, that would make it ipsative. Most often, all that matters is that you pass the guidelines, but you're looking for yes, it is ipsative. Trying to get that. So it is making sure that you are able to look at the test based on your comparison, not compared to anybody else. My Likert scale, you see that all the time. That's that like very much, dislike, all those scales from like usually goes from dislike to very much like. So that's my Likert scale. We discussed the mean, median, and mode already. Let's see here. Normative really just means normal. So normative format or normative scales, the term really just means normal. Okay. Projective test, those are things that Freud would have used. He used the TAT and he used the Rorschach, which are normative tests. I'm sorry, those are projective tests. I'm sorry. Those are my projective tests. So the thematic appreciation, that's your TAT. Freud would have you, look at the picture and tell him what you saw. And whatever you saw really was based on what he would tell you what you really meant. So your projecting. And the other kind on is, of course, the Rorschach, which is the inkblot test. Excuse me. That is my inkblot test. Okay. Thank you. Thank you. Okay. Of course, we talk about reliability, skew, the standard deviation. We'll have the stain on with you, that's divided into nines. Your T-score, you're using tests and you're converting it to, the numbers. However, the T-score is really just the measuring, you're looking at the relationship between two variables or two groups. Okay, and my Z-score, your Z-score reverts to a standard score. The Z-score measures the number of standard deviations. A raw score is away from the mean. Z-scores use 0 as the mean. And you saw that on the normal curve, the normal standard deviation, that they'll use that as the mean. Okay, I'm not going to go over those tests yet. I'm going to go over some questions on research. Okay. So in order for an experiment to be a real experiment, it has to have at least three things. It has to have a control group, an experimental group, and they have to be randomized. All of those things make up a real experiment. A quasi-experiment is missing one of those things. Okay, down here. There's a quasi-experiment is missing one of those things. So quasi is like almost an experience, so it's missing something. Either the control groups are not, the control and the experimental group are not randomized, or maybe there's only one group, and those are fine if that's what you're choosing to measure, but do know that those then are not, they can't be generalized because it's not a true experience, it's experiment. So you may have gotten it from this particular group and it worked well with this group, but I can't prove it works with the other group. So because those terms are not able to be generalized. Again, external validity is whether or not it can be used with others. Internal validity is the test itself. When I'm looking at internal validity, those test numbers, does it match what it's supposed to match? Does it measure what it's supposed to measure? If number 3 is asking me a question and it is supposed to match up with the code of ethics, then does it do that? Internal validity can be threatened by culture, race, or bias. Okay, So internal validity can be threatened by biases, sampling biases, research biases, etc. So that is the way the questions are matched up. So those can be really they can be threatened by biases depending on who's writing the test. Okay, a couple of your simple random sampling. Stratified sampling. You have stratified sampling when you're looking for a certain group. I'm looking for women who are the ages of 40 and 60 who make more than $80,000 a year. So that's my stratified. It's still random, but out of that group, I'm going to then pick who, every third person, every fourth person, but out of that group. Okay. So systematic random sampling. That's when I'm going to, again, I've got a random, but systematic means I'm going to pick every 7th person, every 8th person. So your turn next. Sometimes roadblocks are done that way. If you live in a big city and they're doing roadblocks, sometimes they don't stop everybody. They just stop every certain person, every 4th car, every 5th car. I don't know if the airport works that way. I get stopped every time I go to the airport. So, but that's simple, systematic, random sampling. Convenient sampling are the easy ones. Those are the ones that you send outside the grocery store and you give them a Pepsi or a Coke and you ask them which one they like. Okay? So those are not always reflective of what society looks like. So sometimes that answer can not be totally accurate, but it is convenient. Okay? These terms, nominal just means the categories, your gender, your race, your height. That's how we're rating things. That is my nominal. Ordinal are numbers. 1st, 2nd, 3rd, 4th, 5th, those are my numbers. Interval is time. Ratio is a number. So when you go to gamble, some people believe if they're playing the slots, so every 7th time I'm going to win. Every 7th pull I'm going to win. That's a ratio. My interval is every 20 minutes. So this guy's been sitting in that chair over there for at least an hour. It must be time to win. So he sits now, time is up. So intervals are time. Every 20 minutes, every 15 minutes, whatever. That is your interval. Your ratio is your number. Okay? Again, we talked about t-tests a little bit already. Okay? Traditionally, a t-test is the statistic correspondence with less than 5% probability that it happened by chance. So I'm looking for the relationship between two variables, two different groups. That's how I get my t-score based on a t-test. Okay, so my Anova and Manova, those sometimes get mixed up. So Anova is when I am measuring 2 or more samples. So I'm looking for the statistical difference, and there's only 2 or more. Okay, so it's Anova. My Manova is there's more, a lot more, many more. My analysis of covariance, that is kind of looking at the relationship of those 2 variables. So if I'm using an ANOVA, I'll look at the relationship between those 2. Okay, so your chi-square and your bivariate tabular analysis, those are simply things that you'll use in usually a paramedic test. So your chi-square is a formula, and I'll talk about when to use the chi-square. I'll talk about that a little bit later. Your bivariate tabulate, that is just your x and y when you're plotting those. So that's my x and y. When I'm going to plot them on the x and y, that's all that means. By bivariate. Okay, I'm looking for the relationship bias to relationship between those variables. Bivariate. Okay, here, close these windows. Lots of windows open. Okay, so I'm going to use the blue book to do some questions. I like this book a lot. I'll show you which one I'm using. Let me share it over. Okay, show you which one I'm using. There we go. Okay, this one, this is not the best one to study for when it comes to how to really use the information. It is the best one to study for just to get the content, to understand what the terms mean. So we're going to be using this card, this one today. And I'd really appreciate if you'd give me some answers here. We're just going to I'm going to read them, and if you could chime in, tell me what you think they are, what the answer is going to be, and that'll kind of help us, get some involvement. Ask me questions if you don't know what it is. And please don't be afraid to ask questions or to chime in. I'm sure whatever question you're having, somebody else has, and they just aren't ready to say it yet. Okay. I want to start here, just with some of my questions here. Let me go down. Let me start off. Okay, so this is kind of a combination of research and assessment. I'll start there with 633. Everybody see it? Chime in. Yes, we can see it. Yes, we can see it. Thank you, thank you. Okay, here we go. So we'll start with 633. Let me just go here. You administer a new set of test questions to 5 students in your introduction to psychology class, and you discover that 5 of your questions have an item difficulty index of 1. That means that for those 5 items, we're looking at the difficulty index of 1. What does that mean? A, B, C, or D? Chime in. Be brave.
A.
I got a C, I got an A. Anybody want to take a chance of why? Explain your answer. No takers? Well, let me just go for what the difficulty index is. So your difficulty index really means it's looking at how difficult the test was. Oops, I want that one. Okay, so now that you know that, the difficulty index of 1. So you discover that 5 of your questions have an item difficulty index of 1. So what does that mean? That means they're all pretty easy, right? Yeah, they're all pretty easy.
So
Okay.
wouldn't that mean that everyone answered it correct?
Exactly.
So if the difficulty was like 3.0, that means that the level of difficulty is higher now.
Exactly.
Okay.
Okay. So that was just a really based on knowledge. I want to know if you know what that level of difficulty means. Okay. Number 634. Examiner bias is least likely to be present with which of the following tests? The projective, the objective test, or a projective test, a objective test, a Likert Scale testing, or an IQ test. Examiner bias is least likely.
B.
I got a B. So what are the tests? So what I always suggest is if you're not sure, rule out what you do know. Okay, so examiner bias is the examiner coming in and they're having their own opinions. So which of these would be the least likely? So my projective tests, that's my Rorschach and my Rorschach and my TAT. Of course, those would be biased, right? Because you're interpreting. So that would take that one out. What is objective testing?
having like a direct answer, something that's going to force you to have a direct answer.
So, well, the objective answer is a right or wrong. You know, it's just a fact. So that's a right or wrong answer. So I can say, you know, the sun is shining. That is, or the sun is hot. That's an objective. That's subjective. That's my opinion. I can say that the sun rose this morning at 7:02. That's just a fact. That would make it an objective test, just a fact. My Likert scale testing. The Likert scale, of course, is your opinion on how well you like it, how well you don't like it, or your IQ test. Okay, so I'm pretty sure we ruled out A and C. Yeah, so now it would be down to B or D. So which do you think it is? It's my B. IQ tests are likely to have some bias. We haven't written a totally cultural-free, bias-free IQ test. So that's what they're looking for, that you would know that fact. Okay. So then, Harry's score is a 72 on the WACE IQ test. His score is within what compared to the mean? So compared to the mean, and the mean is 100. So where would he be? How many standard deviations would he be away from the mean?
Is it 2?
How would you figure that out?
I would have to. I'm thinking about the bell curve now, and I know you have to start off. So in I know that it's between 1 and 2, but I feel like it's closer to 2 because it's 72.
Okay, so the first standard deviation would be the 68%.
Okay.
Okay, so 68%, that's always a rule. Okay, so then if it's more than 68, it would be in the second one, right?
Mm-hmm.
Okay. So again, it's 68, 95, 99.7. That's the rule. Okay. So those are just rules. Again, you don't have to. This is information you need to know. So you'll apply it to a question like that one. So what you know is the first standard deviation is 68%, the second one is 95, and the third one is 99.7. So we're basing on 100 because that is where our standard deviation is on a normal distribution. So now we know where he falls, right? Go back to my test there. Yes. Okay, so it is B. It is C. I'm sorry, 2 standard deviations. It's 2 standard deviations. Okay, I want to go back to number 634, and that answer is A, least likely. Least likely. So we talked about the other test, but the answer to that one is the least likely because it is least likely to be present. Examiner bias. Examiner bias occurs when, sorry. Okay. So the answer to 834 is A. Examiner, hold on. Hey, I'm teaching, okay? Okay, thanks. Bye. Okay. Examiner bias occurs when the examiner's expectations about the outcome of the experiment influence the participants. Okay, so this can be easily occurred in projective tests. So this is the one that is likely to be present. It's not least. I read it least likely. It's one that is likely to be present. So I do that as well. So be sure you don't miss us on the test. Least likely.
But if it was least likely, it would have been objective, right?
It would have been, yes. Okay. So that is likely. Okay, number 636. The purpose of an assessment in counseling is to the purpose of an assessment. Why do we do an assessment?
C.
Yeah, C.
C is right. That is absolutely correct. 637. The difference between an assessment and a test. What is the difference?
A.
That is correct. That is A. The difference between an assessment and a test, the assessment gathers information and a test focuses on measuring. Measurement is 630B, 638. Measurement is what is a measurement? You can type in if you don't want to speak.
D.
638 is D. 638 is B. It is B, the process of determining the dimensions of an attribute or trait. Determining the dimensions. So D is comparing. So I don't have to compare. I can just determine it, but not by comparing. Think of your measurements when you're looking. You're determining how size you are, how big the hips are, how long the arms are. Those are your measurements. That's what you're looking at. Okay. And I'm hoping I'm not comparing the dimensions of two objects against each other, because I don't want to compare my dimensions to anyone. Keep them all to myself. They'd be ipsative with my measurements. I'm just competing against myself. So 639, another word often used interchangeably for appraisal is 639. What is that? That
B.
was I hear a B, I hear a C. The answer to 639 is C, an evaluation. An evaluation. 640, the client states that they think they have depression. The counselor administers the Beck's Depression Inventory, the BDI, in order to what? What are you trying to determine when you use the BDI? Have an A, that is correct. That is an A, very good. 641, a psychological measurement is also referred to as,
A.
A is psychoanalysis. That's my Freudian term.
That's C. Psychometrics.
Psychometrics, yes. Psychoanalysis is what the Freudian people do. Psychoanalytic and psychodynamic are used interchangeably for the test. Psychodynamic is what we would use more modern because it is less timely. Psychoanalytic theory started off with, psychoanalytic theory started off with very wealthy people, and you had a long time to go through therapy, and we don't do that anymore. But the answer is C. Psychometry. Psychometrics is the actual study of this testing. So if you're a psychometrist, that's all you do is test. So that is a whole profession. A lot of schools offer, actually, it's a PhD in that, psychometrics, or being a psychometrist.
Don't like measuring. I won't do that.
All you do is test and give it back, right? 642. The CPCE is example of what? What kind of test is a counselor preparation comprehensive examination? CPCE, what is that? A D. Anybody else?
I'm in between B and D.
Okay, so let's just define them. So an academic test would be something you take in your math class when you were in high school, maybe, or college. An achievement test is measuring how much you know. So what have you achieved? That is like the SATs. You know, the GREs, all those are achievement tests. Authentic assessment is not really a term. And then aptitude test is a combination of your ability to learn and as well as your current knowledge. So it makes it an achievement test. Okay, so the NCE, the CPCE, any of those tests that you have to, you know, you're getting a licensure for, the goal is to make sure that you know what that you've achieved these skills.
Okay, what is an example of an aptitude test?
The ASVAB.
The aptitude test.
ASVAB. That is the most common one that kids take to get in the military. And what it does, it looks at what you know, as well as your aptitude, your ability to learn.
Okay.
I will tell you, I took it just to get out of class when I was in high school a million years ago. We had like old pencil and paper tests, and you got to get out of class and take it. But it looks at, I'll try to pull up an example. But what it does look at is like your, like what you do know, and then we're basing on that, then your aptitude. So it looks at like your math skills, your reading skills, things like that. Oh, so just advertisement. But yes, so it not only looks at what we think you should know at this point because you graduated from high school, but then we're measuring those math questions, the science questions, and how well you can figure them out. So they're looking at your ability. Okay. Okay, so which is used? Go ahead. Question. 643. What does aptitude test assess? There's your answer there. What does it assess?
Capability.
Got it. Capability. Are you capable of doing this based on your current achievement and where we think you can go? Okay. So 644. What is used by police departments to screen candidates to become police officers? What would they use? 644.
I'm just gonna go with ASVAB because that was the one that the military used.
That's the military, but not the police.
Okay.
The police use the LEAB, but it is an aptitude test. Let me show it to you. So the LEAB, it's looking for, there are all these areas, and they're looking for how well you do on this one. Personally, I think you should do an MMPI to see what kind of psychopathology many of our police officers have. However, they didn't ask me. So we use the LEAB, the Law Enforcement Aptitude Battery. Okay. So again, that means they're looking at their capacity to be good officers based on their current achievement, their current knowledge, as well as their ability to learn. 645. A psychic says to the counselor, you have a gift. People are drawn to you. Your friends always come to you advice. The psychic is relying on what? Reading their tea leaves.
I would say C.
I got an A in there also. Yes. So it is the Barnum effect.
That's the one I didn't know.
That is the Barnum effect. Think of the circus. And what is the Barnum effect? What is P.T. Barnum? What happens when you go to the circus? Is everything you see at the circus real?
No.
Bigger for you. Okay. There's a sucker born every minute. So the Barnum effect is also called a Forer effect. It's a general description of a personality trait of characteristics that it's so vague it can be used for anyone. Okay, so P.T. Barnum came up with that. It was named after P.T. Barnum because he would say we've got something for everybody. The gullibility. So of course he could say that. Who would not be true with that? So that's the Barnum effect. P.T. Barnum came from the circus. That there's a sucker born every minute. So what that really says is just I can, if I give it general enough, you're going to believe me. Okay. What about 646? The Stanford-Binet. What is it? What is a Stanford-Binet intelligence scale an example of what? What is it measuring? Oh, I'm sorry. It's an instrument of what? What is it? And the answer to that one is it's a cognitive instrument. Okay. So it is a cognitive instrument. That is a test. Okay. And Terman is the one who brought it to the United States. So we know that Theodore Simon and Alfred Binet actually used it. However, it was brought to the U.S. by Terman, T-E-R-M-A-N. That was Terman. Okay. 647, Adam. Adam visited a counseling service center on his local college campus because he's having trouble concentrating, sitting still in class, remembering things, and being organized. The counselor considers giving him an assessment for ADHD. Why?
A.
Exactly. An assessment can be good for that one. You got it. Okay. 648. Second-year students who have not declared a major at the community college are advised to make an appointment at the Career Center to take a strong interest inventory. The strong interest inventory consists of what? A strong interest inventory.
B.
Is that a B or a D?
B as in boy.
B as in boy. The answer is D. It is a education and career guidance. Okay. So then let's look at 650. Sorry, 649. A person's weight can be measured by a scale, but emotions or a person's intelligence are much harder to measure. What are these types of variables called? Things that are harder to measure. What are they called?
Sit down, T. Sit down, T.
Psychological constructs. Wait.
You got it. So this one, if you're not sure, rule out. Rule out. Psychological development, you know that's not it. Okay. So psychological assessments, that's a testing thing. So maybe. And it's not a test. Those are types of variables. So psychological constructs or constructs in general are terminology that we often make up, perceive. So if I'm looking at, your gender is a construct. So I know that your sexual, what you're born with, your boy or girl parts, that is a fact, but gender roles are a construct. So that's all these are is psychological constructs. Okay. 650, an instrument that has already established material and fixed directives for administering scores is an instrument, that means it's a test, that has already established materials and fixed directives for administering and scoring is what?
Just over standard deviation?
It is. It is. Your standard deviation is there already. You got it. Good, good. It's fixed. Good on that one. 651. Brianna is 7 years old and has a remarkable vocabulary for her age. The counselor wants to give Brianna an IQ test in order to gather more information regarding her cognitive abilities. What test would the counselor use? She is 7. Which one should we use?
The one for children.
You got it. And that is the WISC, the WISC-C. Okay. So if it doesn't have it written out, it's the WISC. Good, 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 guys. Everybody know what the Myers-Briggs is? The MBTI, that was based on Carl Jung, based on his anime, his 4 archetypes. Well, sorry, based on the 4, he has more than 4, but the MBTI is based on his archetypes. You get like 4 letters. It describes who you are. So these are really good. I've seen them used I've used them with marital counseling with clients. I think they're really cool even with your children to kind of understand who they are and what kind of personality they have. So sometimes you can find a free assessment if you're interested. But of course, you come up with 4 letters. You're an E, you're an I, you're an S, an N, or T, an F, a J, or P. And they're all the categories that kind of tell you what you are based on. Okay, so if you're an IST, an ITST, etc. So usually you can find a free one out there. Check it out if you have time. It's just pretty cool to kind of know where you're at. And I thought it was really so cool with my children. It helped me understand kind of who they were and how they heard or communicated. Okay. 652. A client is asked by a counselor to remember a list of 4 words. The counselor then asks the client to count forward by 7 and repeat the list of 4 words that she previously mentioned. What is being measured? What is being measured there?
See?
Somebody else? You got it. You got it. I'm doing sequential processing. Sometimes I'll do that in MBTI. I'm sorry, in a MSE. So if you are doing someone's mental status exam, sometimes you'll see that done that way. Good, good. 653, an ink blot test. It's a famous example of what?
Projective.
You got it. It is a projective test. Good. 654, a client is working with a new client who has difficulty opening up. I think that should be a counselor. Who's working with a new client has difficulty opening up. The counselor decides to take a psychoanalytic approach and show her pictures of scenes of random people interacting, and ask the client to tell the story that she thinks is going on, and identify any emotions any emotion that she feels are present in the scene. The counselor is using a projective test known as a what? What is she using?
D.
What was that?
D as in dog.
D, you got it. Thematic appreciation test. I used to see C on the test, the child's appreciation test. I haven't seen that in a while. So TAT definitely is what we're looking for now.
That was a rule out because I didn't know I knew what all the other 3 were, and I didn't know the 4th one.
Perfect. That's all you need to know, though. The goal for the test is you will never know everything. So it's your hope that you will find that you'll be able to just know what you do know and then rule out. Okay. Good job there. A client is ready for discharge from a psychiatric facility. What will the client's counselor be asked to prepare to give other members of the mental health staff involved in the client's treatment? He's being discharged from a psychiatric hospital. So what will the client's counselor be asked to give to the other members of the team involving the client's treatment? What will they ask for?
Is it a report?
Which one?
It's difficult. I mean, because we discharge them with a treatment plan, but I feel like the treatment plan goes for the client. But if we're giving it to the staff, we would give them a psychological report. I don't know.
Anybody else?
I think they would be asking for a treatment plan because a treatment plan would kind of formally, sequentially tell what this client needs to do or what everybody needs to do when the client is dismissed.
Mm-hmm.
What we used to discharge patients with is their reassessment of their initial depression scale or how they're feeling.
Well, a treatment plan isn't often when the counselor is in treatment.
Okay.
Or I didn't answer yet. I'm just asking you. So is they're in treatment or is when they're out of treatment?
Both.
Okay, and that's the key. Okay, so and what information we given to involve the client's treatment? The treatment plan.
Yeah. Okay.
You got it. Treatment plan. Okay. A psychological report most often is just after the psychologist or someone's done some testing and you're interpreting the information. That's most often what you would see that for. Okay. 656. A counselor is working with a client for the first time. The counselor makes note of a client's general appearance, their current state of mind, their emotional state, their attitude, behavior, speech, thought process, and so on. What is a counselor conducting? A, IQ, B, projective, C, depression, D, mental status exam.
D.
I'm sorry, was that B or
D as in dog.
D as in day? D as in dog. You got it. That's my MSE. Okay. So my MSE, I'm sure most of you have seen it or used it. It really kind of looks at how they're doing at this current time. The brief one is most often what you'll see. If you haven't done one yourself, you've probably seen somebody maybe had a head injury or just a little bit disoriented sometimes. If you go to the hospital, a car accident, sometimes you might see that one. Look here for you. So if you haven't seen one, that's it. The mental status exam, and this is a brief one. Okay. So look at affect. So affect, sometimes people, we use it oftentimes as the look on our face, but affective disorder is a mood. So affect, AFFECT, looks at the look on their face, kind of what is it saying up to me? But an affective disorder looks at their mood. Okay. So those are the terms: labile, tearful, blunted, normal range. Your thought content, your thought process, your orientation times 3. Where are you? What's going on? All those good things. That's a brief one. Okay. Anyone had one done on them or used one?
I use it.
For what? If you don't mind sharing.
Intake, like when a patient come in, we do a mini mental status exam.
Mm-hmm. Is that based on any kind of history? I mean, like I have to have an illness or drug exposed. Just why that one, I guess.
We do many because of the short time that we have with them.
Okay. Okay. And Maritza, what did you say?
We use them for, it's called the mini mental status, obviously the mini mental, but we use them for patients who are 55 and up.
Oh, really?
Yeah.
I'm like 54. Oh my gosh, really?
Well,
thank you.
Sorry.
Thank you. Wow, you're out of class. We're done.
I'm sorry.
What's the rationale at 55?
Just sometime, well, at the hospital that I work at, we often get individuals, even younger ones, with early onset dementia. So it's a UHS policy. So.
Oh, wow. Gosh, thank you for.
Sorry, don't go to a UHS hospital.
Oh my goodness. I will tell you though, my family and I cruise. That's what we do for Christmas, and I've already booked next year's cruise, and I did get the 55 and older discount, so I will take it for that. So okay, so my next year. Oh man, but gosh, yeah. And they say that age is only, that number's in your head. That is so not true, but it's in your body. It really is. Enjoy your youth. Okay, let's see here. So we're going to do 657. David's mom is 80 years old. David notices that his mother is irritable and is having serious trouble remembering things. David's concern is that she is decompensating. If the counselor, as part of his assessment, conducts a mental status exam, what should he be concerned about? He's 80. She's 80, not 55. 80.
Dementia.
Thank you. 80. 658.
Sometimes the symptoms come on before
Stop
that.
talking. I don't want that. Yes, I did.
I'm older than you, so what's the same for that? I'm older than you. So.
Yes. Yeah, but you have grandchildren. I don't even have grandchildren yet. I need to remember my grandchildren. Or you have a grandchild, right? You're telling my kids to hurry up. I just need one,
No, let them wait.
They're not in any hurry, I can tell you that. A new counselor has been asked to assist the Social Security evaluations. The counselor was instructed to administer the Wechsler, the intelligence scale for adults, but never trained on how to administer it, score, or interpret the assessment. What should the counselor do? You've never been trained on it. What do you do?
Inform the supervisor?
You absolutely do. Good, good. You got it. Okay. 659. A counselor is working with a Haitian client for the first time. The counselor is considering administering the 16 personality factor questionnaire to his clients. What does the counselor need to take into consideration for completing this assessment? He's looking at the 16 personality factor questionnaire, and the client is Haitian. What should he consider?
C.
Why would him being Haitian keep him from wanting to participate?
I don't know. I just feel like if he can read and follow the instructions, seems a little bit. I mean, he's Haitian. Haitian people speak English.
But isn't there some cultural differences, perhaps?
Yeah.
So especially a personality factor quiz. Let's look at that one. So it's making sure that the client is aware of any cultural differences.
Oh, that's almost like the test that they give after women have babies, and there's a cultural difference. Like most people don't.
Different in all tests. We don't have any unbiased testing. None.
And they always score low, and we have to do a site consult because there's like a language barrier or something. So
when it comes to that, the 16 personality test looks at, let me give you an example of it. You enjoy vibrant social events with lots of people. You spend time exploring unrealistic yet intriguing ideas. Okay, so we're looking at your personality. And just because if you are a different culture sometimes, you may not score the norm, that doesn't certainly mean there's anything wrong with you. It just means that we're basing it on our very American Western culture values as opposed to looking at other cultures. But there's not a test that is not biased. So that is something that we don't do it anymore, but I can't speak for everybody, but so what used to happen is if you, when we live in Tennessee now, we moved here, when you tested for gifted, so to get into gifted in the county I live in was a score of 123 on your IQ. But if you were a lower socioeconomic status, or if you were of color, or English wasn't your first language, then you got a few extra points because they realized the test was not culturally correct. So those few extra points was supposed to make up for what was lacking in culture. Don't know if they do it anymore, but that's kind of how they balance out that test. And that was the WISC.
So the correct answer is A.
Correct answer is A, yes.
Okay.
Okay. Let's see. 660. The NCE would be considered what kind of test?
We already decided that it was a did we say it was achievement?
We did, but that's not one of these options. So what else could it be?
D.
You got it. You got it. You got it. Good job. Okay. So it's not a career assessment. If you've gotten this far, surely you've got your career down pat. Aptitude, it's not your ability to your capability. We know that. We know lots of excellent counselors who have never passed a test, right?
Right.
It's not a personality test. It's not an aptitude test. It is just kind of looking at the achievement based on these standards. Okay, good. 661. What has to be considered when minorities? What has to be considered when minorities participate in psychological assessments or standardized testing? What has to be considered? I think I answered that one already. It's a cultural test bias. Okay. Just some useless tidbit. So one of my very first jobs out of college, I went to school in South Florida. I got my MSW back in before many of you were born. I got my MSW in '91. And one of my very first jobs was working with a Black psychologist who was trying to come up with some testing that were not culturally biased. And he took some of the standardized tests and then tried to view them from a more culturally sensitive area. So that was pretty cool, actually. I was fresh out of school, and I worked with someone who did that. So that's when I realized that's what, for me at least, that's the understanding of how come the tests were not culturally biased, or culturally biased. Okay. Back in the day, that was many years ago. So one of the questions that we'd see on a standardized testing, especially when we're looking at achievement and abilities, could a girl who was 6 years old do her own hair? Okay, so for a 6-year-old white little girl, then of course she can probably brush her own hair. A 6-year-old black girl, if mama paid someone or those braids are in there, she better not touch that. So that's a culturally biased. That is just not acceptable with African American girls, that you touch your own hair. That's not okay. Mama did your hair, and your mom spent money or time on that hair. We just don't do that. Well, that's an example. Okay, let's do this one. 662. Passing the NCE is not based on how quickly one completes the exam, but the number of questions the test taker is able to answer correctly. This is an example of what type of test? 662. What type of test is that? B. Performance assessment. Anybody else? Have a objective test. It is 662 is a C. It's a power test. The focus of the power test is not the speed in which the person completes the test, but the ability of the test taker to answer all of the questions, to answer the most number of questions correctly. Okay, so yes, you do have a time limit on there, but it's a power test. The questions in a power test are often arranged with less difficulty questions at the beginning and more difficulty test levels increasing throughout the test. Did you know that on the NCE? The easier questions are at the beginning. Okay. With the MMPI, Minnesota Multiphasic Personality Test, is considered what type of test? And the Minnesota personality, the MMPI does not determine your personality. Are you a nice person? Are you a good person? Blah, blah, blah. It determines your level of pathology, psychopathology. What's my answer on 664?
Wait, what kind of test is it? Like, I'm having a hard time understanding what type of
the MMPI? No.
Yeah, what it is.
Okay, so the MMPI is it is most often used. It's called a personality test, but it really is not. It is most often used to kind of look at your personality disorder, your psychopathology. So it's 160 forced answer choices. Okay. And the questions are kind of written, so the internal validity, it looks at the same question written like 6 different ways. So trying to measure kind of, it's your level of crazy. It really is. Okay. Close the windows here. Just give me an example there. There we go. See him. So this is what it's measured. You're looking for your anxiety, your obsessiveness, your depression, your health concerns, alienation, bizarre mentation, the anger, cynicism, conduct problems, low self-esteem, low aspirations, social discomfort, family problems, school problems, and negative treatment indicators. So that's what it measures, okay, based on questions, and this is what we're looking for. So many people often think the MMPI, it's the Minnesota Multiphasic Personality Inventory. People think it's a personality test. So the MBTI, the Myers-Briggs, that's looking at your personality. The MMPI is actually looking at your level of crazy, your level of personality disorders. Okay, that's the MMPI. So to go back to that then. Oops. That's my question there. Sorry, I lost my question. Let's go back to that. There we go. Sorry about that. There we go. Okay. So the MMPI is considered an example of what? And it is an objective test. It's not subjective. It's not based on your opinion. It is not projective, and it is also not predictive. Many people think it's predictive. It's predicting whether or not maybe you'll, put someone else in danger, or predictive of whether or not you would hurt yourself, but it is not predictive. It is just subjective. Okay. 665, minorities who are at equal academic abilities may still score lower on IQ tests or standardized tests like the SAT, lower than their white peers. And white peers, not because minorities are less intelligent, but not because they're less intelligent, but because of what?
D.
You got it. That is my bias testing. Okay. Let's do some research. Many argue that the concepts of research date back to when? The answer to that one is 400 BC. 400 BC. Okay, that is A. 667, which of the following are not included as a concept in deductive reasoning? Deductive reasoning. Should I give it some feedback or look at deductive reasoning? So when we look at deductive versus inductive reasoning, okay. Another example. Like that one. There we go. Okay. Inductive versus deductive reasoning. So inductive, someone who's inductive reasoning makes a specific observation, then draws a general conclusion. Deductive is the other way. You have a specific conclusion followed by a general theory. So my inductive reasoning is if I have the observation first, and then I draw a conclusion. I'm inducing, I'm suggesting this is what happened. My deductive reasoning is when I have a specific conclusion. This is what I think, and then I'm going to follow with a specific theory to kind of back up what I think. That's inductive versus deductive reasoning. Okay. So the answer to that one is A. And what we know is there was a major premise, but not a minor premise. So not a concept in deductive reasoning is major promise. I'm sorry, minor, but major is. I mean, these are covered really well in the research chapter in the green or purple book. So if you don't have that, you can feel free to let me know. I'll gladly send you a link to use to further study that. Okay. How about 668? Using deductive reasoning to gain knowledge has been called what? What's it been called? 668 there. Come on, be brave.
I don't know. I feel like C.
It is C. You got it. What'd you come up with syllogism?
Because the other two is like process of elimination.
Okay, that works too. That works too. That works just fine. Okay. And that's the goal, is that you'll know enough so then you'll know what it can't be. Okay.
I'm sorry, I missed that answer. What was it?
Answer to that one was C. Knowledge can be gained from a particular relationship by following downward from general to specific. For example, people with depressed or sad, Sally is sad, Sally has depression. That's syllogism. You're just following that sequence. Okay. About 669. Bacon used inductive reasoning in the 1600s. Inductive reasoning got a C on that one. That is correct. Inductive reasoning takes the specific existing knowledge and makes it general conclusions. That is inductive reasoning. Good job. Good job. 670. Joni is a part of a research experiment monitoring energy levels in depression. She becomes pregnant and tells you she feels very fatigued. Her tiredness is what? Her tiredness is what? Her tiredness is what?
Is it B, intervening?
Yes, it is B. Very good. It is B, intervening variable. So that just means that intervening variables, they may alter your outcome of a research experiment. They're difficult to control. So they've intervened, they've kind of blocked your research. Good. 671. You are studying the effect of a particular medication at different dosage on the symptoms of depression. Oh, you are studying the effect of a particular medication on different diagnoses on the symptoms of depression. Medication doses are what? So you're studying particular medications at different diagnoses. So different diagnoses are here in A. That is correct. That's my independent variable. Perfect. Really good. 672. Studying behavior under a controlled condition to test the hypothesis, looking at cause and effect, and making predictions is what? Cause and effect and making predictions. I have an hypothesis. That makes it's research, right? Or some, yeah. So I'm looking at cause and effect and making predictions. I got an A. 672 is A. That is my quantitative research. Very good. Qualitative is looking at your quality. Quantitative is really kind of proving something, the cause and the effect. Okay. 6 out of 10 dentist surveys prefer blah, blah, blah. Okay, that's really kind of looking at a quantitative approach. Good. In qualitative research study, subjectivity is expected. 673. Is it expected? True or false? There was a question. So when there is the hypothesis, is it quantitative? No. Qualitative and quantitative both have hypothesis. So the qualitative study is looking at the quality. It's your feelings. It is the effect. Quantitative is always the number. For my PhD, the title of my research was Appreciative Inquiry. I was evaluating a program that I wrote. So it was a qualitative, looking at the quality of time they spent in college and how much they enjoyed or what they benefited from the program. But it was definitely hypothesis and proving it. But that goes to quantitative and qualitative. Quantitative isn't money. Okay. I'm sorry, quantity is a number. It can be money, but it's a number. Wow. 674, null hypothesis. What is that? A null hypothesis.
It's nothing, right? Null means nothing. So
it means that you had to null the hypothesis. You could not prove it. So I'm doing research and I have a hypothesis. This is what I'm trying to prove, and my hypothesis is nulled. What does that mean?
B.
You got it. Perfect. B. Yep. Good. Okay. Which of the following is acceptable probability test for scores? What is the acceptable probability level for test in social science? Which one of the following is acceptable? The probability test just looks at the differences between the control and the experimental group. And that one is C. That is C. 0.05, that is acceptable. That means there's a 5% chance that the difference between the control and the experimental group are due to chance. So my acceptable one is 0.05. Okay.
Just standard, like that's just something we should know.
It is. That is an acceptable probability level. So then 676 asks you the same question a different way. What does it mean?
See?
Perfect. You got it. There's a 5% chance of the difference between the control and the experiment group being due to chance. That's exactly what that means. Okay. So setting the acceptable level of error too high can result in what? 677. That one is a type 1 error. That is a type 1 error. Okay, and let's go down to 678. So a type 1 error is what? What is a type 1 error? Got an A? You are correct. Type 1 is when the researcher rejects the null and when the null hypothesis is true. So if I reject the null, that is my type 1. Okay, reject the null, type 1. We'll come across that again, so we'll pick up type 2 in a minute. 679. Which of those words doesn't belong? Which of the following words does not belong? I got an A. The answer to that one is B. Okay, so confounding and extraneous are types of variables, and invalid is also. Invalid is what I would do with a research term, and as I know that we think we'd use valid because we're looking at research, but valid is only about instruments. So was the instrument you use valid or reliable? So that one is valid, does not belong in this sentence, in this category. 680, what is correlation? 680. That one is B. 680 is determining the relationship between the variables. So that's my correlation. And on my correlation, I want it to be between -1 and +1. 0 is a perfect correlation. Okay, that's what I'm looking for. So 681, what is that? Correlation studies may have revealed that the income increases with educational level. This is an example of what? My correlation story shows that the income goes up, as well as if the education level goes up, the income level goes up. What is that one? What kind of correlation would we assume?
C.
That is a B. That's a positive. One goes up, the other goes up. So a paired correlation, I saw where you're going with that. So, but a correlation can be the -1 or the +1. So again, if it goes to -2, it keeps going up, then that is not the closest correlation, but a -1 is a pretty good correlation, but they are negative. Okay. So your client tells you he has a PhD in pharmacy. You know that people with higher education levels tend to end up in jail less than those with lower education levels. This is an example of what? I like that sentence. So just in case you weren't sure, since you have higher education, you're less likely to end up in jail. I'm not telling my kids that one though, but 682, which is that? That is a negative correlation. It is negative. More time that your education goes up, less time you spend in jail. Okay, both are not going up. One goes, the less time you spend in jail is down, and the more time you spend in school is up. So that one is a negative correlation. There's a correlation, but it has to do with one going up and one going down. Okay, 663. When you look at
I'm sorry, so when one is going up and one is going down, it's always going to be a negative correlation?
Negative, right.
And when they're both going up, it's both positive?
Yeah, exactly. If they both go down, it's also a positive.
Okay.
Okay, because they have to match.
Okay, so it's about matching.
Okay.
And what's paired?
What is paired? And so this is just any kind of, when you're doing any research, you're comparing two variables. So in this one, the two variables are the higher education, less time you spend in jail. Okay, so look at education levels and jail. So that's what's paired. Okay.
So, okay, so that's an example of a paired correlation?
Oh, I'm sorry. I didn't hear what you said. What was paired? I got you. I didn't get that. Okay. There's no such thing as a paired correlation.
Okay.
That's not a term. I heard you. I'm sorry. Okay.
So it's either going to be negative or positive.
Well, so if they're both going up, we're looking
Right.
for positive correlation. One goes up, one goes down, it's a negative. If they both go down, it's a positive.
Got it.
Okay. 683. you look at different studies, you find 4 figures, -3, -8, 4, I'm sorry, -0.3, -0.8, 4, 0.4, 0.7. Which number is associated with the closest, the strongest correlation? Which number is the strongest correlation?
Is it the one closer to 0?
Okay, so which one's close to 0?
-3.
You got
Wait.
it. Okay, so wait a minute, let's go back to that one. So the answer to that one is, in the case of correlation was negative. Yeah, the answer to that one is A. Yes. Doesn't matter if it's negative or positive.
I'm just
It's the
close. No.
closest one to 0. You got it. Okay. Which type of variables are the following? Race, color, gender, and city. What type of variables are those looking at?
No.
You got it. That's A. Good. Okay. 685. What does it mean? Rounded to the nearest whole number. So I won't make you do that. I'll just tell you the mean is you add those numbers up, you divide by 1, 2, 3, 4, 5, 6, and you get a number. And I know that there's probably mathematicians who can do that in their head. I'll just tell you the answer to that one is B. That is B. Okay. So the range. What is the range of the following number set? Okay. Do you know how to figure out the range? The range is found by subtracting the lowest number, which is 29, from the highest number. So that is the range. So the answer to that one is C. That is the range. 687. What's the mode?
43.
You got it. That's B. You got it. Perfect. Good, good. Good, guys. You got that one right. Good. 688. What is the median?
43. Again.
You got it. You got it. So if the mean, median, and mode are all the same, then that means that it is a normal standard deviation. Okay, mean, median, mode, if they're all the same, that goes on my bell curve, that's a normal standard deviation. Okay, 689. In normal distribution, blank percent of the scores fall within 1 standard deviation of the mean, and what within 2 standard deviations? That would be correct. That's D. The first one is 68, the second one is 95, the third one is 99.75. Okay. This one says 7.4. The test either way would be correct, and they're not going to do that to you. They wouldn't say 7.4 or 7.5. So it kind of depends on whose research you use, where that number comes from, but it is usually 99.75. Okay. 690. Variance is a square root of standard deviation. Is that true or false? That is false. That is false. 691. The A score is the same as a standard deviation. And if you know or not, that is true. The A score, the AZ score, I'm sorry, the AZ score is the same as standard deviation. So that is the AZ of the AZ score. It's actually the A is the Z, what goes in the mode, median, and mean in the middle. So that one is true. That is true. Okay, that just means a standard deviation there. Anova 692. What is an Anova? What does it do? Oh, sorry. I didn't need to do that. I just totally clicked out of that. Wow. Here we go. Here we go. Sorry about that. What is my ANOVA?
A two-way. Wait. One more than one level.
The answer is D. So it's B and C. Okay. B and C. Okay, so it's used when there's one level of single independent, used when more than one level of a single independent variable is used. And C, one-way analysis of variance. So I'm just looking at variance is just the relationship, the variability, the number of variants. So I'm looking at the difference between, I'm looking to see if there's a statistical difference, a difference. All my variance means. So 692 tells me ANOVA refers to a one-way analysis. MANOVA is a two-way ANOVA. The t-score, the t-test, that is what you use when you are looking between two variables. That's two variables. What about 693? What's double blind? (693). What is my double blind?
A.
It is when neither the researcher nor the person knows. You got it. That is A. And that is just to avoid test bias, because if the researcher knows which one is the placebo, they may have different expectations for that. They may see things that are not necessarily there. So that is the reason for a double blind study. Okay. 694. There are dangers of having researchers know which treatment is subjective, which treatment the subject is receiving. Which of the following research errors has nothing to do with the researcher? Nothing at all. 694. The halo effect. You should remember that always. I wish I could remember his name, but he was just a doctor with these amazing blue eyes. I don't even remember his name, actually. That is
the Hawthorne effect.
What is the Hawthorne effect? You're correct. That is the answer. The Hawthorne effect is people work differently when someone is watching. Okay, so that is the answer, but that is what that is. That was a research study, and what he found is people worked harder when someone was watching them. We don't always say harder, we just say people work differently when we know they're being observed. Okay, so I know when my boss comes in to observe me, the dean at my college, then I am teaching a lesson that he would approve of. So, because I know he's watching me. My teaching style doesn't change, but sometimes the material might change. So he is not of the social work profession. He's not of any of the soft sciences. So when he comes to observe me, I try to actually present something less controversial than I normally would, just because he doesn't necessarily adhere to all those soft sciences. Okay, 695, a positively skewed distribution. Okay, and I didn't talk about those. I meant to talk about those. Let's look at those. So if the mean, median, and mode are not lined up, you have to look at something different. So looking at skewedness. Okay. So if my mean, median, and mode do not line up, then what I have is my bell curve does not look like that. It has some skewedness. Okay. So what I know is if my mode and median mean, so if something is skewed to the right or skewed to the left, that means here's my mean, okay, and they're skewed to the right. So it doesn't have my same peakness. So what that means is, give me an idea. So what that means is then, here we go. So I have a left skewed, that means it's a negative. If I have a right skewed, that means it is positive. So what I'm looking for is the mean. And if it's skewed to the right of the mean, it's positive. If it's skewed to the left of the mean, it's negative. That's if they don't line up on that bell curve there perfectly. Okay. So then we look at it again. So here's the mean, that's my middle, the median. So in a normal distribution, they're all the same, right? They lined up right there. Okay. But in a left skewed, the negative distribution will have this, the mean left to the mediation. Okay. Left and right to the mediation. So right skewed. Okay. My right skewed means that it is, my right skewed means that it is the mean. So see the mean, there is the left, mean to the right. Okay? That's all that means, my skews. Okay? So 695, a positively skewed distribution looks like what? The answer to that one is A. Positively skewed distribution occurs when there's a grouping to the left of the scale. Okay? 696. A researcher completes his study and finds a decrease in the number of reported close friendships are tied to the increasing rates of depression in adolescent males. When he writes his report, he notes that the relationship between the two variables, but adds that this is not necessarily suggests that the depression is a result of the new friendship. This represents which of the following? And you might not know this one either. You don't have any idea on this one? That one is D. It's the correlation versus causation. Correlation versus causation. There are two things. A correlation means it happened at the same time. The causation is suggesting that this caused the other. Okay? So when he writes his notes about the relationship, it doesn't necessarily that there's a direct result. So he's talking about a correlation the two happen at the same time, versus a causation which says one caused the other. Okay? 697. Again, this one you may not know either. A type 1 is to blank as type 2 is to blank. The answer to that one is A. Oh, good. Yes, it's a good AA. So as alpha is to beta. So sometimes a type 1 is called an alpha error and type 2 is called a beta error. Good. How about 698? Lowering the significance level? Lowering the significance level, what does that do? That one is C. Lowering the significance level decreases type 1 errors and increases type 2 errors. Lowering the significance. So we're looking at the statistical significance between the two. So if I lower that, then what I do know is that it decreases my type 1 error, but it increases my type 2 error. Okay. 699, a researcher is determined to determine if the color of a classroom facilitates reading. The color of the classroom, the painting. Okay. After she establishes a baseline reading score for each child, the reading area is painted in several classrooms. In this research, the independent variable is what? Okay. 699. The independent variable is what? That one is D. D. The color of the classroom is the independent variable, and the dependent variable is the reading scores. The reading scores. Okay. 700. The
Can
most.
you explain that one?
I sure can. So how do I know independent from dependent? My dependent variable is sitting there waiting. Oh, do something to me, please. Touch me, feel me, move me, something. The dependent variable is waiting for the independent variable to do something. Okay, so she established the baseline of the reading scores, and then she is looking for, she's measuring the color of the classroom, if the color of the classroom facilitates reading. Okay, so the color of the classroom is doing what? Okay, so the independent variable on that one is the color of the room, and the dependent variable are the reading scores. The reading scores are just sitting there.
Okay, so the reading score is the data.
Exactly, yeah, just sitting there waiting for something to happen to it. So yes, that is the data. Okay. 700. What is the most common probability of a type 1 error? The most common probability? We talked about that a little bit earlier. It's 0.05. That's the most common probability of a type 1 error, 0.05. Okay. That is just saying the researcher rejects the null hypothesis. He will make an error 5% of the time. About 5% of the time does a type 1 error occur. 701. Which of the following is not a threat to internal validity? Not a threat. And that one is C. Generalization is an external validity concern, not an internal. So to be able to take this test and use it with other people, that is a external. That is an external validity. That's why that doesn't matter. That's generalization, general ability. What is the middle value of a list of values in numerical order? What is the middle value? You know that one. Well, the exact middle would be your median. Median. Okay. Again, the median of the following data sets. You know that one. It is A. 709. When the mode, what are the mode and mean in the following data sets? The mode and the mean. And that one is B. The mode is 1 and the mean is 4. Okay. 705, the most common correlation coefficient, the most common one that we often use. Any guys? That's the Pearson R. That is what we use most often. Okay. 709, which scale has no true 0 point and cannot rank other variables? Which scale has no true 0 point and cannot rank other variables? That's my nominal, that is D. My nominal is my age, sex, race, so no exact 0 point on that one. Any number can have an exact 0 point, however, my nominals cannot. Okay. 707, which score on the distribution falls within one standard deviation? I'm sorry, which most scores on a distribution fall within what? And the answer is C. That's 99.75. That's C. That's where they will fall. First one is 68. The second one is 95. Third one is 99. I'm sorry. That one is 99.74. 99%. Okay. 708, Dr. Buck's research has 2 independent variables. In order to complete his analysis, Dr. Buck will what? He will need to utilize a what? It's got 2 independent variables. So his ANOVA will have what?
2A?
2. Yes, it is 2. Got it. B. Perfect. You got it. Which of the following is not a measure of central tendency? Which is it not? Okay, and that is my range. My central tendencies are the ones that are in the middle of my bell curve. So the mean, median, and mode are all my central tendencies. A range is not. Okay. Which of the following scores is considered a standard score? Okay. And that one is D. A z-score is a standard score. A t-score is a raw number that has been converted. A z-score is a standard score. Okay. 711. What is the factorial notation for a problem where one variable has two aspects and a second variable has three aspects? That one is B. That's just 2 by 3. Okay, so the first variable has two aspects, the second one has three. That makes it 2 by 3. Okay. 712. In order to evaluate the impact of particular medication on headaches, the investigators placed participants into three groups. The first group received no intervention. The second group received a pill, but it contained no actual medication. The third group received the medication using an imitation pill, with the second group allowed the investigation. The third group received medication using an imitation pill, with the second group allowed the investigators to control for the what? So the second one got the imitation pill. So what did the other one get?
Placebo.
Got it. That's called the placebo effect. Okay. 713. In order to evaluate the impact of a particular medication on headaches, the investigators placed participants in three groups. The first group received no intervention. The second group received a pill, but it contained no actual medication. The third group received the medication, and the third group received the medication. The first group is what? They got no intervention. What's that called? That is correct. That is my control group. They got nothing. Good, 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 good. Okay, Stanley Milgram experiment. Want to know that one?
No.
The Milgram study was the one where they were told to shock people. There were students involved, and the students that were being shocked did not know, the people that were shocking did not know that it really wasn't hurting them. They really thought it was hurting them. That's the Milgram. Oh, here we go. That's what it actually looked like in the black and white. But what happened is they were both students. So they signed up for this one. And what he found was that people here. Okay, so here we had the person who was, this is the teacher and the student, and the person who was telling them to administer the shock. And what he found was that people were very obedient. What he found that surprised him also was the closer proximity, the less likely they were to be obedient. Okay, so that is the Milgram study. Okay, so 714. The learners were D. The term Confederate. Okay, so Milgram's study on obedience to authority used a Confederate as the learner. This allowed Milgram to have additional control over the experience, and Confederate just means he was part of the, he was in there, he was part of the experiment. Okay. Okay, guys, I'm going to wrap it up. There'll be a copy of this one in there. So if you want to go back and go over it and kind of look at some of those questions, I'm going to actually probably page down a few more questions and give the answers. So if you want to go back later and just watch them. If not, you may go ahead and hang up. If you want to listen to some more, I'm just going to post a few more on there so that way you can go back and listen to it whenever you'd like. Okay? Good luck, guys. You're so welcome. Good luck. Okay, so 716, the answer to 716 is, oops, the answer to 716 is A. 717, the answer to 717 is, which of the following has the strongest correlation? because we know a correlation has to be between 0.10 and -1. So a strong correlation is the one that would be the closest. Okay. And 718 talks about reliability and validity. Know that validity has to be proved before it can be reliable. Reliability is does it test doing the test over and over again, we get the same answer. Your outcome is of course, the outcome of your research, and veracity is just the drive, how hard you work there. So I will wrap it up, and I will close this out. Okay, this will be available for you to watch at a later time in this lesson.